So today I'm going to show you guys the top 3 mistakes people make after they get a knee replacement that stops their recovery and ultimately makes them worse off. So listen up. So the first problem people have with knee replacements is they don't push through the pain enough. And while this may not be true for everybody, a very large percentage of people with knee replacements don't push through the pain as much as they should. You're kind of taught no pain, no gain is something you shouldn't abide by unless you're a hardcore athlete. But I would actually apply the similar thing for people with total knee replacements. Now with that being said, with any of this advice, check with your surgeon, check with your doctor, because everyone has their own story. But I would say that statistically speaking, knee injuries have a much higher risk of you not being able to get your range back because you didn't push through the pain enough than people who hurt themselves because they push through the pain too much. And when I say hurt themselves, I say that in quotes because I mean you damage your knee in a way that it's much harder to get yourself back from. So a little bit of pain in the moment is totally okay. I would actually argue that you should be pushing probably up to 5 times as much in many cases. But with that being said, you still want to make sure that you're doing your exercises properly, and you still want to make sure that your pain is as well under control as can be. Second mistake people make, and this is one you see a lot, is people put a pillow underneath their knee while they're sleeping. This is a terrible idea in so many ways because you want to make sure you do everything in your power to get that range back. So I would take that pillow and just throw it away because you don't need it. However, that being said, if you do need it, one thing you can do is we can kind of compromise halfway, because I understand some people are in a lot of pain and they really can't take it psychologically. I get it. And if that's the case, you can take the pillow and you can put it lengthwise, but don't put it widthwise, and especially don't roll it up here, because you want to do everything in your power to push that knee to being able to get it locked out. If you are unable to get it all the way straight, there is a chance sometimes that you might need to get surgery redone on the knee. And trust me, that's a lot worse than having to go through a little bit of pain in the short run. So make sure you have a pillow, or no pillow ideally, but if you must, keep it straight and all the way down the leg, down to the heel, and it'll be much better for you. And the third mistake people make is they get rid of their walking aid too early. In this case, I'm going to imagine that this broomstick here is a cane, and I'm going to lower it down here just to make a point. When you're using your cane to walk, that's actually helping you. Let's say this is my injured leg. You're actually using this to take some of the weight off when you're walking. And that ultimately makes it easier for you to walk with a normal walking pattern. If you get rid of the cane too early, you might start limping a lot, and you might develop bad habits with your walking, which actually is much harder to train yourself out of. So this is one thing where I would actually say it is okay to have a cane, just because when you have a cane, it helps keep your walking ability normal, so then when you do finally recover, it does become a lot smoother. So these are the 3 things that I recommend, the 3 big mistakes I see people making after knee replacements. Once again, I can't stress this enough. All this advice must be taken in context with what your surgeon/doctor tells you, because I don't know your whole story, but these are 3 things that I see very often that people can do. I'm going to put another video up really soon on the 3 exercises you can do early on to get your range back, because that is the biggest part of your knee replacement surgery. So I'll see you next time.